Welcome to Nurse Academy. Today, we're diving deep into one of the most fundamental yet critical skills in nursing, vital signs interpretation. Whether you're a nursing student, a healthcare professional, or just someone eager to learn, this video will give you everything you need to understand vital signs and what they reveal about a patient's health. Let's get started. Vital signs are key physiological indicators that help us assess a patient's overall health. They include temperature, heart rate, pulse, respiratory rate, blood pressure, and oxygen saturation, SpO2. And sometimes we consider pain as the fifth vital sign. Let's break them down one by one. Normal temperatures to confirm accuracy. Next, let's talk about the pulse rate, the number of heartbeats per minute. The normal range is 60 to 100 beats per minute. Tachycardia, or a fast pulse over 100 beats per minute, can indicate fever, dehydration, stress, anemia, or even heart failure. Bradycardia, or a slow pulse under 60 beats per minute, could be due to medications like beta blockers, heart blocks, or even being an athlete. Always compare pulse readings with a patient's baseline vitals for better interpretation. Breathing tells us a lot about a patient's condition. The normal respiratory rate is 12 to 20 breaths per minute. Let's look at abnormal patterns. Tachypnea, which is more than 20 breaths per minute, can be caused by fever, anxiety, metabolic acidosis, pneumonia, or asthma. Bradypnea, which is fewer than 12 breaths per minute, could indicate an opioid overdose, brainstem injury, or severe hypothyroidism. Kussmaul's breathing is characterized by deep labored breathing and is seen in diabetic ketoacidosis. Cheney-Stokes. Breathing involves alternating deep and shallow breathing and is common in heart failure or brain injuries. Always assess breathing pattern, depth, and effort. Fast breathing isn't always effective breathing. Blood pressure measures the force of blood against artery walls. The normal range is 90 over 60 to 120 over 80 millimeters of mercury. Hypertension, which is high blood pressure over 140 over 90 millimeters of mercury, could signal stress, kidney disease, heart conditions, or even medication side effects. A hypertensive crisis, which is over 180 over 120 millimeters of mercury, is an emergency and could lead to a stroke, heart attack, or organ damage. Hypotension, or low blood pressure below 90 over 60 millimeters of mercury, is often seen in shock, dehydration, or blood loss. Monitor blood pressure trends. A single high or low reading isn't always a cause for alarm. Last but not least, oxygen saturation tells us how well oxygen is being transported in the blood. Normal levels should be 95 to 100%. Mild hypoxia, which is 90 to 94%, may occur in COPD or mild respiratory distress. Moderate hypoxia, which is 85 to 89%, needs oxygen support and could be due to pneumonia or heart failure. Severe hypoxia, which is below 85%, is a medical emergency and is often seen in ARDS, respiratory failure, or suffocation. If oxygen saturation drops below 90%, act fast. Oxygen therapy might be needed. Now that you know how to interpret vital signs, let's summarize what we've learned today. Temperature, fever, think infection. Hypothermia, could be shock or sepsis. Heart rate, tachycardia, possibly fever or dehydration. Bradycardia, could be medications or heart block. Respirations fast, think pneumonia or acidosis. Slow, could be opioids or brain injury. Blood pressure high, could be hypertension or stress. Low, possibly shock or blood loss. Oxygen saturation below 90% indicates respiratory distress. Vital signs aren't just numbers, they tell us a story about the patient's health. So always assess, interpret, and act accordingly. That's it for today's lesson. If you found this video helpful, hit the like button, subscribe, and turn on notifications so you don't miss any updates. Let's continue learning together at Nurse Academy. See you in the next video.